Hi, I'm Dr. Juan Albino. I'm an interventional pain specialist at the Neuroscience Group. There's many causes of back pain. One of the causes of back pain will be joint pain coming from the facet joints. Actually, it's the second most common cause of back pain. So after a patient has gone through what we call conservative treatment, including physical therapy, chiropractic treatment, oral medications, and rest, if none of those treatments have been effective or beneficial enough to relieve the symptoms, we can go for more invasive options. Among these options, one of them will be the facet injections. Back pain most of the time is multifactorial. One of the major causes of back pain, as mentioned already, is the facet joints. The facet joints are these joints in the back of the spine, and they are in charge of allowing movement of the spine in certain angles. For example, in the lower aspect, they allow your spine to move forward and move backwards. As you go up in the spine, they allow more rotational movements. These joints are again the second most common cause of back pain, just because of the location and what they do in the spine. Most of the time, when a patient goes backwards and puts pressure on those joints, that's when they will feel more pain. Again, when they also do rotation, they may feel pain. And most of the time, if they lean forward, they may see some relief. When a patient is having pain coming from these joints, in most cases, it will stay in the back meaning not shooting down the legs. It may radiate. Radiating pain is different from shooting pain. Radiating pain is pain referred from the low back, mostly to the buttock. It could be in the thigh. Usually it never goes below the knee. The radiating pattern per se depends on which joints are affected. Usually the lower joints may radiate to the buttock, it may radiate to the thigh. You may have some pain radiating also around the hip region. What we're looking here at is a lower spine. This is the lumbosacral region, specifically the L4, L5 joint. This is a needle, and this is what we are calling the facet joint right there. This is the anterior-posterior view, slightly angled. As the needle goes into that joint, we can also see part of that other joint right here. If we take out the side view, we can see how the needle gets where the joint is. This area right here is the joint that we're talking about. Again, this is the L4, L5 joint. This last segment here will be the L5S1 joint. This is an intra-articular injection. Usually when the needle gets inside the joint, a mixture of a local anesthetic and a steroid is injected. The anesthetic will get the diagnostic response of pain relief for a certain amount of hours. The steroid will decrease the inflammation if there is inflammation in that joint, and that's the one that will get the long-lasting relief, which could vary from weeks to months. The outcomes of these interventions are based on what the symptoms are. Every time an intervention is offered, the physician should sit down with the patient and discuss the possible outcomes and expected benefit. This intervention is meant to alleviate pain. It may cut down the symptoms for an extended amount of time. It doesn't mean that it will relieve the issue, but it may be a good way to manage the pain.